What is the difference between inherited and sporadic breast cancer? Imagine your genes as a set of instructions that determine many things about you, including your risk for certain health conditions. When it comes to breast cancer, these instructions can sometimes carry mutations that influence how and when the disease develops. There are two main types of breast cancer based on how these mutations come into play: inherited and sporadic. Inherited breast cancer happens when gene mutations are passed down from your parents. These mutations are present in every cell of your body from birth. The most well-known genes involved are BRCA1 and BRCA2. If you carry these mutations, your risk of developing breast cancer is higher than average. Inherited breast cancer often shows up at a younger age, sometimes before age 50. It can also involve tumors in both breasts or multiple tumors in the same breast. Because these mutations are in all your cells, they can be passed to your children, making family history an important factor. People with inherited mutations tend to have a higher lifetime risk of breast cancer and may also face increased risks for ovarian and other cancers. Genetic testing can help identify these mutations, guiding preventive steps and treatment options. On the other hand, sporadic breast cancer is caused by genetic mutations that happen during a person's lifetime. These mutations are not inherited but are acquired due to various factors like aging, environmental exposures, or random errors in DNA copying. These mutations are only present in the tumor cells, not in the rest of the body. Sporadic breast cancer is more common and usually occurs later in life. It typically involves a single tumor in one breast and usually isn't linked to a family history. Since these mutations happen randomly, relatives of someone with sporadic breast cancer generally do not share the same increased risk based on that mutation. To sum it up, inherited breast cancer results from gene mutations passed down from parents, leading to earlier onset, multiple tumors, and sometimes cancer in both breasts. Sporadic breast cancer develops from mutations that happen during a person's life, usually later in life, and involves a single tumor without a family history. Knowing whether a breast cancer is inherited or sporadic helps doctors decide on the best screening, prevention, and treatment strategies. Always remember, if you have concerns about your risk, talking to a healthcare professional and considering genetic testing can provide personalized insights and guidance.